What's up, everybody? Welcome back to my channel. My name is Timisha, the Codepreneur, as well as your transformational coach. Keeping it raw, real, and relatable here on YouTube, helping you transform not only spiritually, but also professionally. So, on today's video, I want to talk about what do you do when you are a tired, burnt out rehab professional? What are the next steps in this journey and in this career? So, if this has been something on your mind and you're like, you know what, Tamisha, I'm really getting tired. What should I do next? Then this video is for you. All right. So, in this profession, burnout rate is quite high. All right. And the reason I say that, and like I said, I'm going to keep it real and raw with you guys. The burnout rate is quite high because of the demand. The demand that is placed on therapists, assistants can be very demanding, especially when you are walking into a situation where you are having these regulations of productivity and there's a certain level of quota that needs to be met. And that is structured around patient care or the amount of patients you see for billable hours, as well as billable diagnoses that are considered rated high versus low. I'm not going to jump into all of that, but just know that the demand can be quite a lot. And this, I'm sure nurses can relate to this. I'm pretty sure anyone in a healthcare position can relate to the level of burnout that happens when you are in a field of direct patient care. There is an expectation that the more people we work with, the greater our return will be. Okay, you could be a nurse, you could doctor, whatever it is, it's all about patient demand, right? The more patients we have, the higher amount we can bill. And then, of course, with the changes of PDPM, we want high rated diagnoses that will pay a higher rate than maybe what's considered a lower rated diagnosis. I know it may sound crazy, but just know that there is a system behind how we bill for treatment services and sessions. Okay. So you're here because you're like, what do I do when I feel tired? I'm getting tired and I can feel the burnout coming. Now, first thing I want to tell you is you want to listen to your body, right? Listen to your body. Don't ignore these symptoms. Don't try to just throw it behind you. Don't try to cover it up. Don't try to pretend that it's not there. It definitely is there and it's knocking at your door because too often we don't listen to our bodies and then it is manifested physically where now we are physically affected via sickness, mental difficulties with emotional regulation. And there's just so many things that can occur when you are feeling highly stressed. And it's not to take away from the profession. The profession is a really good profession, but at the end of the day, we are in business and we are in the business of patient care. But we do have to take care of ourselves. So what I want to tell you, there's three options for you. Okay. If you're tired, there's three options for you. Option number one. Okay. Option number one is you can shift what you're doing. Now, this is going to differ depending on your years of experience, but you may shift out of the actual direct patient care and probably go into more or teaching or academic work. Okay. That could be an option is maybe completely coming out of the clinical setting and actually going into a field where you can still give back to the clinical world via teaching. Okay. Now, this is going to apply to my OTs, my PTs, my speech therapists. When it comes to the assistants, the pool for this is a lot smaller. Now, assistants can teach, but you're most likely going to be teaching in assisted programs, and you're most likely going to need a bachelor's in order to do that. But again, academia can be a little challenging to get into because it's all about networking. It's all about who you know. But that could be an option. You can go into teaching, right? The other option is that you can go into a non-clinical role, which means you can completely leave rehab care. So this can be maybe administration. You can look into clinical reviewer. If you want to know like the different positions of non-clinical, I do have a video. Go ahead and check that out. And that's going to give you a little bit more insight into non-clinical roles. So that is an option number two. Option number three. So option number three is you can go into business for yourself. Yes, you can go into entrepreneurship. Okay. Now, I am a coder. I have a bachelor's degree and I have over a decade years of experience in the clinical role. Now, I made the decision to step out and become an entrepreneur. And I'm not saying that you need to completely leave the profession and maybe go open up a restaurant. You can if that's what your heart desire, or you can utilize your skills and leverage your skills in order to monetize it to start your business. Now, for me, I have done that. I have leveraged my skill, I've monetized my skills, and I have decided to utilize my skills to create my online business. My online business is transformational coaching. Okay. So this is an option for you. If you're like, you know what, I think I might go the non-clinical route and become an employee again and get another job, fine, perfect. Do you, boo boo? If you are saying, you know what, Tamisha, I think teaching might be a good look, let me look into that. Do you? Or if you're like, you know what, Tamisha, I think I want to get into business for myself. I want to monetize my skills. I want to learn how I can make money off of what I already know. I don't want to throw away all these years of experience that I have built. And I want to be able to still utilize my degree that I worked so hard to get. If this is you, I'm going to do something that I don't normally do. I want you to go ahead and book a call with me and let's talk about it. I don't normally open this up because I don't want to have a whole bunch of people booking calls with me, but I am going to do this because I believe that as we go into 2024, I want you to go in strong. I want you knowing what you want to do. And I want to give you hope that you don't have to live in burnout. Okay. So go ahead. You're going to see down below that I have my calendar. Go ahead and book a 15-minute call and we can talk about it. And maybe I can guide you along the path on what you should do. It'll definitely make a difference if I can find out what's going on. That'll give me more context. And then we can take it from there. If you want to ask me questions about what I'm doing, what is life like as a codepreneur, right? How do you get started? What are you doing? Feel free to ask me those questions. Just go ahead and book that free 15-minute consultation call with me, and I will do my best to guide you in the right direction. So, as a tired rehab professional, you can be physical therapist, you can be an occupational therapist, assistant, as well as a speech therapist. This is what you can do next. You can either go into teaching, you can just get a different job altogether and jump back into the job market, or you can take your skills, monetize it, and create a business, an online business specifically for yourself. So I hope that this video was helpful. Please go ahead and leave your comments below. I love to read them. And until next time, bye bye.